Today we will discuss about autoimmune diseases. Here is the contents which we will study about definition, causes, types, symptoms, diagnosis, treatment of autoimmune disease. First of all, what is autoimmune diseases? An autoimmune disease is a condition in which your immune cell mistakenly attack your body. As you can see in the diagram, the normal immune response guard against germs. When it sends these foreign invaders, it sends an army to fight them. And the nerve cell can tell the difference between the foreign cell and your own cell. But in case of autoimmune disease, lymphocytes cannot recognize their own cell, and it release protein called the autoantibodies that attack the healthy cell. Then there are the symptoms that are responsible for the causes of autoimmune disease. The symptoms may include the infectious disease. In the infectious disease, autoimmunity may occur when the component of virus or bacteria resembles protein in bodies, for example, streptococcus bacteria. And in case of environmental factor, includes the lack of sunlight, vitamin D deficiency, chemical exposure, and other environmental factors have been linked to different types of autoimmune disease. Next is the lifestyle. In the lifestyle, we take an example of smoking that appears the risk of developing rheumatoid arthritis and grave disease. And most importantly, the diet that we are taking have the fats, high sugar, high protein, and high salt are thought to promote the development of autoimmune disease. Next factor includes the genetics. Several autoimmune disease appears to have run in the families. Next is the types of autoimmune disease. Autoimmune disease are of two types. It's the organ specific, in which the specific organ of an organism will affect, and it's systematic. Autoimmune disease, the individual, a whole system of individual may be affected. In organ specific autoimmune disease, some of the more common organ specific autoimmune disease includes the autoimmune thyroid disease, which may include the Hashimoto disease and Graves disease. In the Hashimoto disease, the immune cell attack cells that create thyroid hormone that leads to an underactive thyroid called hypothyroidism. And in case of grave disease, it is a condition in which thyroid gland produce too much thyroid hormone that leads to an hyperthyroidism. And the symptoms in symptoms in which in case of grave disease includes the hexophthalmos, in which bulging eyes appear, greater arrhythmia, in which heartbeat too quickly or too slowly with an irregular pattern, nausea and diarrhea, oligomenoria, in which irregular menstrual cycle, muscle weakness, tremor, sweating, headache, weight loss, nervousness, and emotional instability are the symptoms that include in the grave disease. And in case of Hashimoto, the common symptoms includes the brain fog, greater constipation, menstrual changes, fatigue, dry skin, blister nails, and muscles and joint pains. Next is the type 1 diabetes mellitus. Type of diabetes mellitus occur when autoantibodies destroy the beta cell in the pancreas that are responsible for making insulin. Having no insulin means that insulin cannot be transported around the body properly. That leads to an high blood sugar level. And the symptoms includes the weakness, visual impairment, and constant feeling of hunger, unexplained weight loss, frequent infection of the genital urinary gland, and frequent urination, dry mouth, nausea, vomiting, abdominal pain, and strong thirst. Next is psoriasis. Psoriasis is basically is the inflammatory disease in which the immune cell erroneously sends signal to skin cell to grow too rapidly. Normally, our skin cell grow and shed when they are no longer too needed. But in case of psoriasis, Immune cell disrupt the healthy formation of the cell of the skin cell, and the skin cell multiply too rapidly, and these extra cells cause an allergic reaction and form inflamed patches. And they may be of psoriasis may be of several forms. The most common being is plaque psoriasis, which is characterized by red patches, which is called the plaques, and their symptoms include the discoloration of nails, joint pains and swelling, redness on the skin, dry and scaly skin, and red patches on the skin. Next is the multiple sclerosis. Multiple sclerosis is the condition in which the autoantibodies attack the fatty myelin sheath that lines the nerves and damage myelin sheath, and which protect our the central nervous system. Uh, so as the damage of the myelin sheath, it slows the transmission speed of messages between your brain and spinal cord and from the rest of your body. And the symptoms includes brain problems, which include the cognitive dysfunction, short-term memory problems, difficulty in concentration of words and finding issues, and the mouth inflammations, digestive problems, urinary problems, and muscles problems, which includes the impaired nerve communication that leads to weakness and tremor, muscles tightness, and sensory problems, spinal cord, and vision impairment occur in multiple sclerosis. Next is the Guillain-Barré syndrome. It is basically the disorder of peripheral nervous system. Peripheral nervous system, in which the autoantibody attack the sport cell that lines the nerve cells, and the immune cell attack on nerve cell outside the brain and spinal cord, that leads to sensory changes and weakness that start from body extremities and spread upward. As you can see in the diagram, the healthy nerves, the affected nerves, and the healthy nerves, the myelinated sheet cover the nerves, but in affected nerves, myelinated sheet are damaged and exposed nerve cells are appeared. The symptoms include the limbs weakness, difficulty swallowing, shortness of breath, and flaccid paralysis, in which the muscles shrinks and become weak and ineffective. Next type is systematic autoimmune disease. A systematic autoimmune disease, in which the whole system will be affected, and it can bring about several type different issues as their effect are felt throughout the body. And there is some examples includes the rheumatoid arthritis, systematic lupus erythematosus, inflammatory bowel disease, and Sjogren's syndrome, and antiphospholipid syndrome. First of all, systematic lupus erythematosus. Lupus is a skin disease because of it commonly produce rashes on the skin, and it affect many organs like joints, kidney, brain, and heart. And their symptoms includes the shaped rashes and red patches, heart problems, severe abdominal pain, blood circulation issues, muscles and joints issue, kidney problems, lungs, mouth and nose ulcer, and the hair loss, high fever, and abdominal headache are the symptoms of systematic dermatitis. Next is the rheumatoid arthritis. It is basically the joint disease. It causes immune system to attack healthy tissue in the joints. Includes both the hand, wrist, and knees, and their problems includes symptoms includes the fatigue, morning stiffness, joint pain, minor joint swelling, fever, numbness, tingling, and decrease in the range of motion. Next is the inflammatory bowel disease. In the inflammatory bowel disease, An immune system responds to environmental trigger that leads to inflammation of stomach and gut, and it may be of two types. This is Crohn disease or ulcerative disease. And the Crohn disease inflammations start from mouth to anus, and in the ulcerative colitis, it affects only the inner lining of large intestine and the rectum. And their symptoms includes, in case of ulcerative, is the pus in stool, fatigue, rectal pain, and fail to desiccate. But in case of coherent disease, nausea, vomiting, mouth sores, and the swellings of eyes. And the common symptoms that show in both are the diarrhea, stomach pain, weight loss, low fever, cramming, bloody stools, low appetite. The next is the Sjögren's syndrome. In Sjögren's syndromes, autoantibodies attack gland that manufacture tears and saliva, and it is a chronic autoimmune disease that typically affect adult. And their symptoms, common symptoms include the dry eye, mouth, throat, and nose, which cause an inflammation around the eyes, throat and nose, dental problems, dental decay, oral yeast infection, digestion issues, joint pain, fatigue, and a large lymph node. Next is the phospholipid syndrome. Um, in case of antibodies, the body produce antibodies that attack certain protein that binds to phospholipids. The result is the formation of blood clots and sometimes leads to the heart attack, stroke. And their symptoms may include the eye problems, heart problem, and the kidney problem, and leg ulcer, and stroke, epilepsy, and pulmonary disease, pregnancy, mortality, and digital gangrene. Next thing, as you can see in the both types of autoimmune disease, there are some common symptoms that are general in the autoimmune disease, which may include the fatigue, fever, joint and muscle pains, and digestive issues. Diagnosis, there is no single test that can diagnose autoimmune disease. Number of tests includes in which the some are the erythrocytic sedimentation rate, in which the an erythrocyte sedimentation is a type of blood test that measure how quickly erythrocytes that settle at the bottom of the test tube that contains a blood sample. Normally, red blood cells settle relatively slowly. A faster than normal rate may indicate the inflammation in the body. Next is the C-reactive disease. So the C-reactive protein test. C-reactive protein test measure the level of C-reactive protein in your blood. C-reactive protein, which is CRP, is a protein made by liver, and it's sent in your blood stream in response to the inflammation. Inflammation in your body, they protect your tissue if you are injured. And this test is used to find out to monitor the condition that cause inflammation, which includes the bacterial infection, fungal infection, or inflammatory bowel disease. It diagnose and also it diagnose the lupus and rheumatoid arthritis disease. Comprehensive metabolic panel. A comprehensive metabolic panel is the blood test with 14 different measurements, and it is often used to evaluate liver function, kidney function, and nutrient level, because it includes multiple measurements. As you can see in the diagram, glucose, calcium, protein, albumin, total, and erythrocytes, which includes sodium, potassium, concentration, and kidney test and liver test. So, as it includes multiple elements, the comprehensive metabolic panel offers a broad look at different functions of the body. As a result, it may be prescribed in a number of contents, which includes to help to diagnose and measure the condition like the diabetes and kidney and liver disease. Next is the rheumatoid factor test. As from the name it shows, it is used to it is used for rheumatoid arthritis disease. Treatment. Treatment can't cure autoimmune disease, but they can control the over active immune response and bring down inflammation, or at least reduce pain and inflammation. Drugs that used to treat this condition includes the naproxen, brufen, or immune suppressing drugs. And also the treatment also available to relieve pain, like the pain, swelling, fatigue, and skin rashes. Eating a well balanced diet and getting regular exercise may also help to feel better. Thank you.